Hello, good morning, and peace be upon you. Today's lesson is on communication skills, and this is part 1 of the communication skills. And what I'm going to touch upon is basics of communication skills. Why it is so important to teach communication skills, especially to health professionals. It's very interesting. Doctors interrupted the patients. Doctors interrupted the patients in 18 seconds. So when a patient came to a doctor, and a patient is expressing himself, talking himself, telling about his disease, doctors only took on an average 18 seconds to interrupt the person. Now, let us imagine you are telling something very important to someone and that person interrupts in 18 seconds. What is going to happen to you? 50% of the patients complains. When the complaints of patients are analyzed, which they lodge to the regulatory authorities or to the higher-ups, 54% of complaints are because of the lack of a knowledge of a doctor, lack of any surgical or procedure skill of a doctor that is related to an attitude, is a general way of thinking and expression. Communication. Reluctance to depart from strictly medical model. Why this happened is because traditionally there was a model by which the doctors and the patient relationship used to occur. The times have changed. So therefore now those models do not hold. Doctors have to be more patient, have to be mastering communication skills to communicate according to the researches in educational psychology or psychologies per se. What is a communication? Basically, it is sharing. It is sharing of information. So it could be sharing of emotions. It could be sharing of thoughts. It could be sharing of views. It could be sharing of judgment, etc., etc. But important thing in communication that we are talking about is uncontaminated. So uncontaminated sharing of information, emotions, thoughts, views, judgment, etc. is per se communication. Why is communication important? What is the impact of communication? It results in increase in learning at an undergraduate and postgraduate level. All 3 domains of learning, whether it is knowledge domain, skill domain, attitude domain, communication, if it is good, results in increase in learning, and if not good, then it might learn a decrease in learning of these domains of learning, or not to that extent that can be done because of a very good communication. It encourages desired motivation. Very, very effective tool to increase the motivation in students or anyone is an effective communication. Similarly, causes desired beliefs and values to become stronger. So therefore, if you want the desired learning behavior should occur, the desired beliefs and values should be encouraged in students, then communication is one tool which is very effective in this. Let us say, what do you call about this communication? Isn't it interesting? See this video kindly.
Of all human communication is nonverbal, body language. 30% is your tone. So that means that 90% What you saying? Enough.
Nonverbal communication. It's an understanding, a discovery, a way to get what you want. It connects all of us. It's just a look. Nonverbal communication. What you're not saying. Our overall communication is perceived in three main ways. 55% visually. This includes body language and how you look. 38% vocally, how you sound. And 7% verbally, actual words you speak. When you add the visual and vocal components of communication together, you can see that nonverbal communication accounts for 93% of the impact of your message.
What you say?
Well, in other words, what you say or use verbally only accounts for 7%.
You are crazy.
Not quite, but let me explain. Communication skills involve more than just speaking words. Sometimes, what you say has little meaning over how you say it.
Do you understand the words that are coming out of my mouth?
One point worth mentioning is that as humans, we talk at an average of 100 words per minute, while we actually think at 800 words per minute. That's nearly 50,000 words per hour.
Blah, 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 blah. Get to the point.
Having good body language and the way you look has a big influence on the overall message you convey to your listeners.
Why?
Well, for example, if you are speaking to someone confidently using your voice, while your body language suggested that you're uncomfortable, this will send a mixed message to your listener.
Of course.
So in other words, the way you listen, look, and react tell the other person whether or not you care and how well you're listening. The nonverbal skills you send either produce a sense of interest, trust, and desire for connection, or they generate disinterest, distrust, and confusion. And as the saying goes, actions speak louder than words.
You are smart.
Thanks a lot, Gramps. Glad we understand each other now. So this goes to show that as humans, we tend to rely on nonverbal communication when words are absent. All it takes is a look, a nonverbal cue to understand a situation.
This is Sparta!
Using gestures and your appearance are great tools often used to help convey the message. However, it can also mislead your listeners if used improperly. This leaves
Okay. Since it's a basics of communication, so let's understand what is a verbal communication and what is a non-verbal communication. Verbal communication is symbol based, non-verbal is gesture based. So verbal communication is done by talking. And obviously, letters are also symbols. Whereas non-verbal communication is based on gestures. Those gestures could be of the body, that could be of the face, that could be movement of eyes, that will be how I am talking, how my hands are moving, how I am talking to you. Now the important thing is that verbal communication is largely learned and it is consciously controlled. So whatever I am talking to you, obviously this material has been learned by me related to communication skill from literature. And I am consciously controlling myself at this point, what I have to talk, what I don't have to talk, where I have to stop. Whereas non-verbal is largely innate and partial control. You see, I have my style of talking. Now when I'm talking to you, I'm moving my hands like this. As I suddenly realize, I jerk my head like this. When I'm coming forward to you, going back, sometimes I'm smiling, sometimes I'm not smiling. This is largely innate, but it can be partially controlled. As I try to control myself, my gestures also when I'm talking to you. Like, I try to control my posture. I know I've got a bad posture, but by talking to you, I'm controlling it. In verbal communication, since the thing is under the control of the human mind, so therefore, there is a risk that there is a high risk of deception. Actually, your belief and value may be something else. You may be knowing something else, but you can deceive the listener by giving him different knowledge or anything. But in non-verbal communication, it's relatively uncontaminated. Therefore, once you're talking to someone, from his facial expression, you come to know somehow he is hiding something, he's not telling something, and there is some problem. Exactly, this is how the teachers can find out if they are face-to-face contact with the students, that actually how much they have understood and how much they have not understood more, in fact, by means of non-verbal communication than verbal communication, provided it's a small group teaching in which teacher is interacting with all the students. Result, you see, body language 55% towards the message impact, tone of voice 38% towards message impact, 7% towards message impact. Whatever in this lesson is producing an impact on you, maybe in terms of learning of domain of knowledge or an attitude as you are seeing me. Actual words which are being spoken out of a mouth, that is only 7% impact. 38% is my tone. Sometimes my tone varies, sometimes I speak low, sometimes I speak high. And I emphasize important words. 30% impact is that. And 55% is towards the message back to body language. See my body? Sometimes I speak low, sometimes I speak high, sometimes I emphasize on important points. I have spoken the same words as before, but now I have added to that, to my tone, body gesture, and that is going to have more impact on you. Whenever you want to an effective communication, and communication which should have an impact, the first thing is exclusivity. If you want to talk to someone, if you want to communicate to someone, may that be patient, may that be a student, may that be anyone else, first is exclusivity. Please do not talk in front of everyone. Produce a setting which is exclusive. That could be your office. You can take someone outside to the garden, sit over there. You can take someone to cafe and talk over there. In cases of patient, you can request the people standing, please, I want to talk to the patient. Can you go aside for a minute? If you want to communicate something which is important. Second thing is setting and seating. Now, once the confidentiality has come, setting and seating. You see, if I am talking to you like this, face to face, as you are seeing me, if I'm talking to you like that, it is as if I am confronting you. So therefore, always do not sit across the person you're talking, sit on the side, like this. Slightly on the side, with your face like this. Now you see, if I'm talking like this is a better, or I'm on the side and talking like this, which is better? Is this better or this better? Obviously, when you sit on the side or stand on the side and talking with slightly curved, looking onto the patient with a smile, that has much more impact because the environment becomes friendly, it doesn't remain threatening. That is how a teacher should talk to the student or doctor should talk to the patient. Opening the communication. Once you open the communication, then during opening the communication, open the communication in a pleasant way, with a smiling face, with greeting, with talking something good, then coming to the main point, talking some pleasantries, and then come to the main point, what you're talking about. Building a rapport, building a confidentiality, building a trust with who you're talking is very important. Now that can only come with time, but if you have little time where you can talk, the little gestures like confidentiality, that is exclusivity, setting, giving all attention to the person, smiling, listening to him, can produce the effect to build a relationship of rapport, build a relationship of trust. The most important thing in communication is listening, not talking. When you are listening, then what I mean is active listening. That is, whatever the other person is talking to you, his words are going to your mind, you are seeing his gesture. At that time, you are actively analyzing what communication is being done by the partner. And in case to have clarity, it's very important to ask for clarification. You can say, I'm sorry, I couldn't understand you. Would you kindly repeat it? Paraphrasing. I've understood, but let me rephrase or let me paraphrase it for you, and I'm going to speak. Please check. I'm understanding correctly what you are saying. Thinking. And summarization is very good also. At the end you can say, very nice, you've given very good thoughts. Let me summarize that so that I'm not missing any point in summary. In this way, you would be understanding exactly what the other person, may that be a student, may that be a patient, is the information he's giving to you is correct. May that be history taking, may that be counseling, may that be breaking bad, anything. You see, if you are a teacher or if you are a doctor, you are at the dominating role. The person who is sitting in front of you, he has fear, he is anxious, he will be reluctant to talk. So therefore, the teacher or the doctor should encourage the student or the patient to talk. An effective way of talking is by means of the gestures like yes, yes please, yes. So this is a prompt. Another way of prompt is just repeat one or two words of what the patient or the student has said at the end of every 2 or 3 sentences. These are called as prompts. the purpose of communication is not to give information, but a student may be in trouble and obviously patient is always in trouble. Very important communication to show empathy. Empathy means you should inform the student or a patient who has some emotions. Okay, look, I understand you have this, like if they're angry, you tell him, I understand you are feeling angry, and possibly if I was in your position, I would have also felt same. I understand you feel frustrated. If I was in your position, I would feel same. I can understand the pain you are going through, like to a patient, the problem we are facing. This is called as empathy. Most important is ventilation. If somebody has come to talk to you and he has something in his heart and he wants to share with you, he only wants ventilation. There could be someone who could hear what he wants to say. So let him ventilate, let him talk, let him speak out, and do not disturb him, especially if he's in an emotional state. So key points to remember for effective communication is separate emotions from the issue. When everyone is talking to you, there are two elements in this communication. One is emotions of the person talking to you, and one is the information or the issue. Please, during communication, separate these two. Emotions may be different from the issue. The issue would be resulting in emotion, but they may be totally different thing. There could be same issue. One may be feeling angry on that same issue. One may be feeling frustrated at that same issue. One may be so much frustrated that he may be wanting to self-harm himself. Therefore, principle number 2 is deal with emotions first and the issue later. First deal with the emotions according to the psychology, and then deal with the issues later. Since it is basics of communication, this first lesson, I am not going into the detail of how to deal with emotion and how to deal with the issue. This lesson is present in my YouTube channel. If you want to listen to it, if you want to revise it, kindly go to my channel SHUKR, there is no A in it, SHUKR, education, right? Communication, part 1, basics. Thank you very much. I hope it helps you. Have a good day. Always remain smiling. Always remain happy. Always remain joyful. See you again. Have a good day.